We're joined now by Dr. Ashish Jha. He's Dean of Brown University School of Public Health. Dr. Jha, always good to see you. Lucky us, you're here on a day we really need stuff to sort out. Nobody better than you at this. So let's get started. We just heard Dr. Burke say that it's up to the future. Looks devastating right now. And I guess the question is, I've heard it described as a dangerous tipping point. I guess my question to you right away is, why is this happening and why is it happening now?
Yeah, good morning, Gail, and thank you for having me on. It's happening, I think, because people are getting tired of all the restrictions. And I think we're heading into colder weather where people are spending more time indoors and people are letting their guard down. And again, the things that we've talked about in the past, like mask wearing is very uneven, and put all of that together, and we are seeing, I think, a dangerous acceleration of cases, hospitalizations, and deaths.
Yeah, you heard the president say last night on 60 Minutes that the reason why the number is so high is because we keep testing so much. Does he have a point?
You know, unfortunately, I wish he was right, but he doesn't, because while we are testing more than we were testing back in April or May, our testing's been reasonably flat over the last month, 6 weeks, up a little bit. But what is really going on is a lot more infections, and we can see that in the fact that hospitalizations and deaths are also climbing. More testing wouldn't explain that.
You know, the other thing, we look at cases like Little Maggie, that just because you get COVID doesn't mean it's going to be a fatal infection for you. The thing is, you don't know. You don't know if you're going to be one of the lucky ones who gets it and then doesn't have very severe symptoms and doesn't require hospitalization. Then you have Maggie, who's young, who gets it and then still has lingering effects.
Yeah, you know, this is a very unusual virus in that large chunk of people end up having very mild symptoms. Obviously, a small proportion of people end up dying. But there's another probably 10 or 20% of all people who get infected who end up getting pretty sick and sometimes recover and sometimes just end up having long-term symptoms. It's really much, much better to avoid this virus than to sort of, you know, roll the dice and hope that you're one of the lucky ones.
I totally agree. We just heard Chief of Staff Mark Meadows say, listen, we cannot control this pandemic. And then when he was asked why not, he said, because it's a contagious virus. Is that the way to look at it? We can't control it?
No, I mean, I don't know where to begin on that, Gail. There are lots of contagious viruses. We control many of them, most of them. Lots of countries have controlled this virus. The idea that America is somehow uniquely incapable of managing to control an infectious disease strikes me as odd. We certainly can control it, and we should.
Now, Vice President Mike Pence, as you heard, is on the campaign trail. He's considered an essential personnel, but people close to him, his chief of staff, his body man, 3 other aides have tested positive. He's head of the coronavirus task force, Dr. Jha. Should he be out campaigning during this time?
You know, Gail, this is not a close call. He should absolutely not be out of quarantine. The CDC makes special dispensation for people whose work involves critical infrastructure. So it's not about essential personnel. Obviously, he's vice president. That's important. It's about, are you doing things that are critically important for the health and well-being of the country? I don't think any of us think campaigning, as important as it is critical infrastructure for our country. He should really be in quarantine.
All right, Dr. Ashish Jha, I'm going to send him your number. He needs to have a conversation with you. Thank you so much for joining us this morning. We really appreciate it.